Hey guys, welcome back to my channel. If you are new here, please do subscribe so that you'll get notified every time I upload a brand new video. So let's begin. In this video, we are going to study acute pharyngitis. As you can see in this picture, there is an infection or the inflammation of the pharynx. So in detail, we are going to study the definition, etiology, pathophysiology, the signs and symptoms or the clinical manifestations, what are the lab tests, how do you approach a patient, and then lastly treatment. So let's study the definition of acute pharyngitis. Pharyngitis is basically defined as an acute inflammation or the infection of the pharynx or nasopharynx, which is mainly caused by the most common pathogen, which include Group A beta hemolytic streptococci, which is also called as strep pyrogens. That's why the pharyngitis is commonly called as strep throat. So basically the pharyngitis is caused by the pathogen called Group A beta hemolytic streptococci, which is also called as strep pyrogens or streptococcus pyrogens, and that's why it is the pharyngitis is commonly called as or commonly known as strep throat. So this pharyngitis can be a part of generalized upper respiratory tract infection, or it can be a specific infection which is localized only in the pharynx region. So this pharyngitis can be generalized or it is localized only in the pharynx region. So what is the etiopathophysiciology? What is the etiology and pathophysiology of acute pharyngitis? So there are various pathogens which will cause acute pharyngitis, and we are going to study all of them now. So the first one is rhinovirus, which will enter the body through ciliated epithelium lining the nose. So basically what this rhinovirus does is, so it will enter into the body through ciliated epithelium, which is the lining of the nose, and then it will cause the edema or the swelling and also hyperemia, increased in the blood of nasal mucous membranes. That's why we see the patients who are suffering from pharyngitis, the mucus or the nasal mucus will be reddish in color because of the hyperemia, and also it will be swelled or it will be swollen because of the edema that is caused by this rhinovirus, and that will cause increased secretory activity of the mucus glands. Therefore we can see a lot of mucus, a lot of sputum coming through the nose or the cuff, and which will cause swelling of the mucous membranes. Obviously when there is a increased secretory activity of the mucus glands, there will be swelling of the mucous membranes of the nasal cavity and also the pharynx, and therefore narrowing of the nasal passages occur. So this is what the rhinovirus does to the body. Next is adenovirus, which is also a pathogen that causes pharyngitis. So it will directly invades the pharyngeal mucosa and causes the signs and symptoms, or it will manifest as cough with the productive or non-productive sputum. Next pathogen is herpes simplex virus. It is also a type of virus which will enter into the mucosal surface of the through the nasal area, and then it will initiate the replication, so that clinical manifestations come into picture. Next pathogen is influenza virus, which can cause pharyngitis, and what this influenza virus does is it will invade the respiratory epithelium and cause necrosis of the cells of the mucous glands. And the last but one is coronavirus. As we can see here, coronavirus, it will enter into the host cell and it starts replicating the viral genome. It will start replicating the RNA, thereby the clinical manifestations coming to picture like fever, sore throat and cough, headache, myalgia, etc. We will study the clinical manifestations in the later part. Some other common pathogens include human immunodeficiency virus, cytomegalovirus, respiratory syncytial virus, and enterovirus. So these are the common pathogens which will not, these 4 or 5 pathogens these are not commonly seen, but basically the Above viruses like adenovirus, rhinovirus, HSV, influenza, coronavirus, these are the most common pathogens we see in day-to-day life that will cause pharyngitis. So how does this pharyngitis manifest as, and what are the signs and symptoms does a patient will suffer from when he is having pharyngitis? So the first one is the patients who are suffering from acute pharyngitis due to rhinovirus. So we can differentiate the clinical manifestations based on the pathogens which is causing the acute pharyngitis, and we can see here the acute pharyngitis which is due to rhinovirus is associated with constellation of coryzial symptoms. So basically the patients who are suffering from acute pharyngitis due to rhinovirus will have a group of coryzial symptoms, that is like runny nose, congestion of the nose, sneezing, and also fever is seen in case of these patients. Coryzial symptoms is nothing but the symptoms which will come into picture, the symptoms which are similar to that of common flu or common cold. So those are called as coryzial symptoms, which include runny nose, congestion, sneezing, sometimes coughing, and fever. So the next one is the patients who are suffering from acute pharyngitis due to influenza virus. So this may little bit vary, that is it is associated with fever and myalgia, which is muscle pain, a lot of body ache will be there, headache also will be there, cough, sometimes non-productive cough also will be there, and the pharyngeal exudate, that is the sputum. Acute pharyngitis from HSV infection, that is herpes simplex virus infection, those patients will show pharyngeal inflammation. You can see the pharynx through the torch into the patient. So the pharynx will be little bit inflamed and reddish in color, and also there will be white patches will be there in case of pharynx. So acute pharyngitis which is coupled with the fever, tiredness, fatigue, generalized lymphadenopathy can also be seen, and also splenomegaly is seen in some cases, which is a characteristic feature of acute pharyngitis due to Ebola virus or cytomegalovirus. The next one is acute pharyngitis infection, which is associated with human immunodeficiency virus. The patients who are suffering from this disease or this condition may show fever, myalgia, that is muscle pain, arthralgia, whole body ache will be there, malaise, tiredness will be there, and non-pruritic rash will also be there, meaning the red patches will be there, the red rash will be there, but it is non-pruritic, meaning it will not, the patient will not scratch the skin, but basically he has red rash. So what are the lab tests we are going to study now? How do you basically test an individual who is suffering from pharyngitis? So the most common method involved, or the technique which is used nowadays, is throat swab and culture, and this is used to diagnose bacterial infections in the throat. So basically what the doctor or the healthcare professional does is he'll take a swab, cotton swab, and then he'll just insert the swab through the mouth to the pharynx area or the tonsils area, and then he'll collect the mucus which is surrounded by the mucosal area or the tonsils. So from that he'll collect the mucus, and then he'll detect whether the patient is suffering from what type of pathogen, whether it is a bacteria or the virus or any kind of pathogens. So this throat swab and culture test is having sensitivity of 95%, meaning this test is 95% accurate. And also the next include rapid antigen detection test. This is not so commonly used nowadays because RT-PCR has come now, that is reverse transcriptase polymerase chain reaction. So that is most widely used and most commonly used nowadays, but rapid antigen detecting test is not very much used. But this also helps us to detect or directly detect the presence or absence of any kind of antigen which is present in the body. So how do a doctor will approach to patient who is suffering from pharyngitis? So this is a general approach to treatment. So once the diagnosis of the pharyngitis is made, once it is clear that the patient is suffering from pharyngitis, then the healthcare professional has to decide the appropriate supportive care that means like when to initiate antibiotic therapy, what is the duration of therapy, what are the dose, what are the contraindications, all he has to take into picture. Then he has to decide what type of treatment has to be given to the patient. Then the selection of appropriate antibiotic therapy will involve careful consideration of cost. Also, now we have a lot of antibiotics, but the selection of the appropriate antibiotic will have careful consideration of cost. What is the cost of that product or cost of the drug? How much is the safety and efficacy of the drug? And what is the potential regimen adherence? So basically, when you prescribe a patient with the antibiotic, he'll not be much adhere to that regimen. So we have to make sure that the patient is fully adherent to the regimen what we are giving to the patient. So that we must take into consideration. Next, the antibiotics therapy is reserved basically for those patients with a positive lab test. The patients who are the patients who have come with the negative lab test, then for those we can give some empirical treatment. Whereas in case of patients who have positive lab tests, then we can give the antibiotics therapy. So what is the non-pharmacologic therapy? Basically, besides antibiotics, what else or what other drugs can be used to treat a patient? So most commonly antipyretic medications are used, like paracetamol, acetaminophen, and some non-prescription lozenges can also be used nowadays, like cough syrups, etc., strepsils, etc., and some sprays are also used which contain methanol. And also we can use topical anesthetics for temporary relief of pain of the pharynx, and also the analgesics like acetaminophen and NSAIDs can be used for the pain relief. So here we can see in this picture, paracetamol can be given, which is also comes in the form of 500 mg and 650 mg also. And then we can give cough syrups or strepsils, which is 2,4 dichlorobenzyl alcohol will be there, and amyl metacresol lozenges is there. So basically this is medicine for sore throat or strep throat or pharyngitis. Next is pharmacologic therapy, meaning the use of antibiotics. So basically, so the first and the foremost drug of choice is penicillin. So it has a narrow spectrum of activity and it is readily available. Obviously penicillin is readily available, it is safe and it is inexpensive. So now a new formulation has come, that is once daily ER formulation of amoxicillin has come, that is which is the drug of choice for the treatment of acute pharyngitis. So this amoxicillin is used nowadays very commonly. So this amoxicillin comes in the form of 500 mg or 250 mg, any kind of dose can be used, but this is used in case of adults and also children who are 12 years and older. So in case of penicillin allergy patients or the patients who are suffering from allergy to penicillin, for those we cannot use amoxicillin or penicillin, but erythromycin or first generation cephalosporins such as cephalaxin can be used. So in case of penicillin allergic patients, erythromycin can be used, or that is macrolide, or first generation cephalosporins like cephalaxin can be used. Nowadays the newer macrolides has come besides erythromycin. So the newer macrolides include azithromycin and clarithromycin, which is of 500 mg BD, and sometimes OD can be used, that is once a day 500 mg azithromycin or clarithromycin can be used, which is equally effective as that of erythromycin and may cause fewer side effects. Next is in case of recurrent episodes of pharyngitis, we can use amoxicillin clavulanate dose. Amoxiclav has come now, which is used for recurrent episodes of pharyngitis to enhance the bacterial eradication. Next, the impact of appropriate use of antibiotic therapy. So what is the impact when we use the antibiotic therapy? So we can reduce the duration of signs and symptoms by 1 or 2 days, and we can also reduce the severity of pharyngitis when initiated within 2 to 3 days of the signs and symptoms. The last is the duration of therapy for pharyngitis is 10 days to maximize the bacterial eradication. So the duration of therapy is 10 days. So this is all about acute pharyngitis. If you have any questions, please do ask in the comment section, and please do like, share and subscribe to BioScope, and I'll see you in the next video. Bye.